September meeting.
We're testing the mics.
I have We good? All right, so we have a quorum. Call the meeting to order. Minutes, everybody get a chance to look through them. Any changes or addendums? Can I get a motion to approve?
Also move.
Second the motion.
Second from Brian. All in favor?
Aye.
You gotta go around. We gotta go around. Everybody,
Gotta go around.
yes. Say your name and how you vote.
Brian Cobb, I approve.
Bruce Dillon, approved.
Drew Kogel, approved.
David Harden, aye.
Okay.
You can say I approve.
I like mixing it up, just to keep everybody on their toes.
Deborah Campbell, approve.
And then-
Anderson, approve.
Okay. Do we have any wishes to be heard this evening? See none. Any new staff? Any new faces? Yes, a couple of faces. Couple.
Hi, I'm Zachary Gotze. I'm a recent graduate from IU studying biology and Germanic studies, and I am the new Lead and Healthy Homes environmental health specialist.
Welcome aboard.
It's nice to meet you.
Welcome.
Welcome. All right. Let's do COVID and flu updates.
I'll keep things brief. Things are looking better here recently, so that's nice. So virtually looking at COVID numbers, they have been pretty consistent for the last 2 months. So basically about 3 to 5 cases per day reported each day for the past 2 months, which is almost kind of midway up a peak. It's been kind of an interesting, just kind of a low, steady level. So the hospitals currently, I think there's like 6 patients in the hospital, actually 3 in the ICU, which is higher than it has been. But yeah, most of the winter has been about 4 to 6 patients in the, at least over in HRH with COVID. So flu numbers, thankfully, are starting to go down the last 2-3 weeks. So one of the worst flu seasons we've seen here in quite some time. I know the state database goes back 5 years. I've heard worse than 10 years. It's been a while. It's been a while. Sadly, February was a very rough month for our flu deaths. We actually had 6 flu deaths, which is in February, which is twice as many as we had all last year. So hopefully, those were the only deaths we've had so far this flu season. Hopefully, we're getting out of that very, very rough flu season. But yeah, it wasn't uncommon to see 15 to 20 people over at HRH with flu. Currently, there's 7 people with flu and none in the ICU. So that's good news. There was a little bit of a bump of RSV about a month or so ago. I think that's actually quite low at this point. So that's really hasn't been much to say about that, but yeah, just grateful that the flu season seems to be improving. Hopefully we're coming out of this over the next 2-3 weeks, but still at reasonable levels. So you'll still have friends that'll still have it because we're at such a high peak. We are probably currently at about the prevalence that we were at last year's peak flu season. So it was just twice as high as it was last year. So we're thankfully on the way down. So.
Do you credit that to any specific thing?
I don't know. I'll be curious to see what the kind of end of the flu. Usually at the end of the flu season, they'll kind of give us some more information about the flu shots and how they're working. I mean, it's a couple variants of flu, but nothing too exotic, really. I mean, the most prevalent strain the last week is H1N1, and we sure have heard about that for a while. That's been in our last several flu vaccines. So I've got a lot of those questions too. Why was it so bad this year? What were our vaccination rates? Why were we seeing more breakthrough with the vaccine than I think I've seen in the past? Dr. Kogel can.
Yeah, it's been a mixed bag, I would say, in my office. Initially, it was people that were not vaccinated, but then it became, so the strain changed. That's probably what it was. Because we don't know, we just know if it's A or B, but not down to what strain it is. So exactly what's in the flu shot. Yeah, still seeing some COVID though. It's out there too.
Yeah, it's
Still all positives.
still few.
Can I ask one more question? Anything, maybe this is related to measles. Just all the stuff, anything, are we seeing anything in
think there are any cases in the state that I'm aware of, unless somebody heard. I haven't checked in a few days, but yeah, not that I'm aware of as of now. So, yeah, just keep knocking on wood.
Kentucky had some, I think.
Did they
I think I
most
saw
recent?
notice,
Okay.
'cause
I
we have
haven't
like, we have partners in
read
New
that.
Albany, and they were kind of getting, I saw some emails going out, that like, hey, you're down in the southern part of the state, but nothing was in Indiana.
Yeah, so, but yeah, the MMR vaccine still seems to be doing quite well against measles for people that have had it.
There's a question. I think I saw this in the Indianapolis Star last week. Level of vaccinations is only like at 70% for the state of Indiana for measles.
For measles?
I thought that's the number I saw.
I would have to take your word for that. I would have to look that one up.
But I thought, or maybe that was nationwide.
Yeah,
But it was shocking, it seemed shockingly low.
yeah. Yeah,
So this
we're-
is on like, kids 3 and under.
Oh, 3 and under?
Yeah, like 3 and under.
Let's say, we have been looking at some of that. That may not be too far off. I don't know. Do you remember what numbers we're seeing, Nicole? I didn't bring that.
For MMR,
Yeah, for MMR.
no, I mean, I know our 3 and under is lower all around. I don't know MMR off the top of my head right now.
Yeah, but I want to say that may be correct. I'm always curious how they figure out the denominator, especially county by county statistics. But yeah, I mean, for the state of Indiana, I would hope we'd get most of that right. So 70% might be about right.
With Indiana being a no opt-out state as far as for school-age kids, that helps to get vaccination rates up, but you can not go to school. You can homeschool, there's different, you have other options you can do and not be vaccinated, but you can't opt out of the MMR if you're gonna go to school in Indiana. Public school.
Oh, good, I didn't know that.
So I have some people asking me if, adults, if they should get the MMR if they got it, the MMR when they were younger. Of
not the
course,
current.
I'm of the age that I had all of those. But I know at the hospital, they watched my titer and I had to have a booster.
They're currently not recommending that.
Okay,
It's expensive to get a titer if you're an independent
yes, hopefully the
person.
hospital.
If your employer's paying for it, then that's a
Yeah.
different thing, but independently, it's cheaper to get the shot.
Yeah.
Just go get the booster, but that's not what they're recommending at this point.
Okay.
Yeah. It's gotta have a lot more cases before you start seeing.
Thank you.
All right, advertising for Health First Indiana.
Yes, we discussed this at the last meeting, and we're just gonna continue talking about ideas on how we can continue to advertise for the community awards through Health First Indiana. We haven't had a discussion with the advisory team quite yet, because they meet tomorrow. So we'll discuss it, but the general plan is to do some interviews with those who currently have awards and show some of the numbers and the success stories and kind of build off of that. The state, Indiana Department of Health did offer to come to a class that was being hosted by Purdue Extension and bring their camera crew and interview and kind of create a story. We're holding off on that a little bit because that class was going to be postponed. But we know that we have that option as well, and they can come out and make a story. So that's kind of the plan, is to build on the awards that we have so far. The round that's going to be considered tomorrow was a little over $600,000 total in applications. And we have a little over $1 million to award in 2025. So we know we'll have at least one more round this year of applications.
Krista, this has probably been handled in the past, but I just don't recall. Is there reporting back to the Indiana State Department of Health of success stories and some kind of metrics of the bang they're getting for the buck that they're investing?
Yeah, they have actually quite detailed reporting system that we put in numbers. So one of our staff is working with other staff to put in all those numbers monthly. So every month we put in, it's like number of birth certificates, number of death certificates, number of inspections, a whole list of data on activities, the meetings and events, anything that we can track. we're putting in that state system, and they're gathering that from all local health departments so they can show how this funding is being used. In addition, they are kind of highlighting those success stories with videos and interviews and that type of thing that really bring to light visually kind of what those events look like.
Are you looking for ideas or just kind of keeping us
Just
posted?
gonna keep you updated.
It sounds like
I mean, if
you're
you
on the right
have
track.
any-
No, I think that's
Always
sounds
open.
good. I'm at a loss for anything. All right, let's go to new business then. The resource guide.
Michael's gonna present on that.
Hi, I tried connecting to the display. It says I'm connected, but I don't see myself being connected. Finish trying to see. I guess while we're trying to figure out the tech part of it, I can explain what this is. Also, hi, I met a lot of you 5 years ago on tiny little black squares on the computer, and now I get to meet you in real life, so that's cool. I am a public health educator at the health department, but I also coordinate our Hendricks County Health Partnership, and I feel like I could talk about that for like 5 hours, but we're basically a local group that meets to try and improve different community health needs that we've identified. And so one of the ways that we've been able to do this in the past is with our community resource guide. So my predecessor and some community partners put together a resource guide that essentially will categorize all of our resources here in Hendricks County. Very robust, had a lot of things in there. But it was also, oh, it's me. It was also kind of, it was a little basic in that you would click on a thing that you were interested in, and then you would see everything under the sun related to that one thing. And so if you clicked on resources related to housing, you would get everything from like first-time homebuyers programs to like house insurance, like maybe you're homeless and you need to find shelter. Everything related to housing was essentially on one page, and it was for the most part organized by alphabetical order. And so a lot of times, people would they would make it to the website because when you search like Hendricks County, like mental health or whatever, usually the resource guide will be one of the first results that comes up, but they would have problems actually finding the specific thing they were looking for. And so I kind of wanted to, I've been working on a way to essentially revise the resource guide, make it more user-friendly, but also make it more effective. And so that's essentially what this is. So here's the Hendricks County Health Partnerships homepage. I'm just gonna click on resources over here. And you scroll down a little bit, there's a very colorful and brilliantly made logo. And then a little further down, there's the actual tool itself. And so kind of some of the highlights of this is that one, it's interactive. Two, there's built-in measures for people to get for them to get follow-up. So if they want to, at the very end, they can essentially ask for a follow-up from someone in the health partnership. So I would see it first, and then if I saw somebody that would be more relevant, I could send it to them. But there's a follow-up component, and I can also see the number of people who have taken it. So it gives us more of a metric data, so we can see which resources are the most sought after during several different points of the year. Which helps us know what our current needs are on an ongoing basis. And so I'm just gonna kind of show a basic run through of what this looks like. And so I just clicked on get started. As you can see, there's quite a few resource categories here. And so I'm just gonna click on addiction recovery /support. And it'll ask you which best describes the type of addiction recovery needed. So somebody looking for outpatient treatment, looking for addiction support groups, looking to stop using tobacco and vape products, or looking for overdose prevention support, so things like Narcan. And so I'm just gonna click on outpatient /inpatient treatment. And it will take me to this little page here that kind of briefly will summarize what that resource page actually is, just in case people maybe had a misconception about what it was, but I think it's pretty straightforward. And then right here as well, there is a way for people to get that follow-up component as well, and then there's also an option to retake. And so I'm just gonna click on this. And then it will take you to the resource page. So there's two ends to this. There's the pages with the actual resources on them, and then how you get there. And so essentially there's over 60 different pages that look like this of different resources. And so as you can see at the top, it will explain the difference between outpatient, inpatient, support groups, and tobacco cessation. And in a more specific way, a lot of the organization descriptions were very long before. It'd be like, in 1832, we opened our doors up because we believed in it. And like, people don't really need to see that when they're looking for a thing. So a lot of that was scrapped. It focuses more on what do these providers actually provide for you, and then what are the, like, what's their contact information, where are they? And some of the providers that I worked with, I was able to do a direct referral system. So if somebody was on this website and they clicked on, like, get a referral or whatever, they could do that directly from this page. And so, like, for Advantage Counseling and Training, you can see here some of the programs that they offer just by scrolling through, and it's quite in-depth. And then all of our inpatient and residential treatment facilities are on here as well. Smoking and vaping cessation, so we have the quit line and then some local resources as well. I'm gonna go back, oh my gosh, my voice is cracked. Pretend you didn't hear that. I'm gonna go back and do a different resource. So some of them are a lot more straightforward, like food and nutrition. So that one, if you click on it, it will take you straight to the food and nutrition page. There's no extra questions there. And then it breaks it down by just a few categories. So food programs, food pantries, and then farmers markets. And so you just click on this and fast travel to food pantries and see a list of all of the updated food pantries that we have here. And then I'll just do one more because I could do this like literally for every single one of them. I talked about housing earlier, so maybe I will click on that one. So housing is one of the most complicated needs in Hendricks County because there's so many different types of assistance related to housing. So we have homeless and looking for shelter, rent, utility, and mortgage assistance, income-based housing, housing programs, and then housing legal services. And so if somebody was homeless and looking for shelter, they click on that one. And then you can see on this page, every single resource is kind of categorized in a way that is most relevant to the resource itself. So like for shelters and transitional housing, this one is broken up by just the physical location. So other resources are grouped by like city. So it'll be like Danville, Avon, Plainfield, wherever. This one is just what are the resources in Hendricks County, because there's actually not that many. There's like 2. And then specialty housing, then housing in Indianapolis, which I technically don't have anything there yet, because I'm trying to keep it more local, and then eventually I'll build more onto it. But specialty housing like Sheltering Wings, Veterans Assistance Foundation, other things like that. And yeah, honestly, that's, I feel like I've covered most of the things here. It just has built-in ways for people to get help. Does anyone have any questions?
Just a couple.
Yeah.
One, do you have any way to track how many people go onto this website?
I do. So I just did our annual report. Last year, there were 36,000 people that came to the Health Partnerships website to use their resource guide.
Oh my gosh.
So quite a few.
Wow.
21,000 of those were people that were like unique visitors. So some people would come back consistently, about 10,000 would come back consistently, and 21,000 were individual users.
So how is this, because I'm in the health board, I didn't know this existed. So how do people know this exists?
I'm so glad you asked. We got a grant 4-ish years ago, basically right when I started. They were like, here's money. We got a grant from the Community Foundation for $30,000 to promote the resource guide. And so once I learned what the resource guide was, I knew I wanted to make a better version of it before we started promoting it. And so now that it's here and live and ready, we have a whole marketing campaign that will be happening this year and the year after, just for promoting this. So we have a lot of different channels. We'll be hitting a lot of different demographics, age groups. We'll be sending mailers to specific neighborhoods that have an underutilization for different services like SNAP and WIC. And we also we're going to be partnering, the goal is to partner with all of the businesses on the resource guide to let them know, hey, you were on this thing. We would like to train you or your staff on how to use it so they can help their clients. We have toolkits we'll be putting together for several service-oriented agencies so that way they can help their employees and also help their clients essentially find the help they need. Because we know that a lot of times if somebody has a need for mental health, there's also other things that they need as well that the provider may not be aware of. So we have a huge plan to kind of just start very heavily promoting it starting in April. So you'll probably be seeing it around.
Sounds great.
This is amazing, because, if someone's in some sort of crisis situation, and you've got about all of them on there, they don't know where to begin to look, and a lot of times there's cofactors that go with it, and they should be able to find help here. And I like the fact that there are, if you need more information, contact. So, Michael, kudos.
Thank you.
It's really good.
So you did it already just since you launched this week?
Oh, so I haven't promoted this literally at all. I've been quietly working on it and getting the kinks adjusted. And even with me not promoting this, technically 650 people have already used it in the last week. So I put this on the website on Friday, and it was like Friday at 3 o'clock. And then when I came back on Monday, there was already 600 people that had used it. So, which is both good and bad because I wasn't finished, but I'm glad that people used it.
I have two questions. So other organizations that might be in the area, like I saw Avon Food Pantries, I know just one other one already that may not be on there. Do they come to you to get added, or
Oh, yes.
how does that work?
Yeah, there's a form that will be added to, right now it says if you have an update, suggested edit, or addition, to contact me. That was the traditional way. Since then, I've made a form to kind of streamline the process. And so essentially people just fill out this form, I get the info, I contact them and just confirm, and then I'll get it added to the resource guide. So there's a couple of ways that we do that.
And then one more question. So I heard you say that you're doing a lot of this. Do you have a team? Because if like all of a sudden you hit the lottery, you're a millionaire, what happens to the site?
I'm taking it with me.
Right.
No. Thankfully, the partnership has a lot of people that are very much involved in community work and things like that. So the goal is to get as many people trained as possible. And so just amongst the partnership, I will probably be forming, I have one other person, Chase Cotton, you probably may know, who I'll be teaching the ins and outs of how
That's
this
what I'm
works.
saying, like who's your
So,
backup? Like,
yeah.
is that Ian?
So it won't just be me. In terms of how to use it on this end, I'll be training a lot of people on how to. Eventually, I would like to teach people how to use the back end, so that way if something happens to me or I leave or whatever, people can update it still and know how to use it. And then, oh, I forgot to mention a couple of things. It will still, even though it's published, I still want to focus on improving it constantly. So one of the goals is to get it so that the resources and everything on this page is available in several languages, which requires coding, which I've been having to learn for this, and I'm really going great over it. But that's the goal, to have it in several different languages, and then also just, there was one other component and I had forgotten, so never mind.
Sounds like a great summer internship opportunity for somebody. Come in and
Yes.
get some experience.
That's awesome. Good job.
That's great.
Good job.
That's awesome.
Turn lights back on.
Any other questions or anything on that?
Time to promote it.
Yeah.
Promote it.
Yeah,
Get it out there.
time to advertise.
I know.
Just the mental health side of it for people in the community. I mean, yes,
Yeah.
hey.
Well, if you are going
In
to
my
t-shirts to promote it, I'll do it.
Perfect.
Yeah, I'll hand that
Sweet t-shirts.
I hand that to the office, so I just accuse us to point them in the direction, because they usually have a project or something.
QR code to scan.
There you go. That would be good.
Yes, there we go.
We got the annual report emailed out to us. Any highlights, anything that we need to make sure on the record?
Much topics did you want to highlight?
Nothing particularly. I mean, you may want to talk about the budget changes.
finance.
Yeah, the finances are a little
Yeah, there's
different
quite a
this year.
big difference on the
Yeah.
finance page, so, on the finance page, you'll see, normally we have that pie that shows how we're supported, and there's a lot more grant funded this year. So we had less tax dollars, but I want to reiterate that our appropriations, like everything that we've asked of the county, was appropriated the same levels that they always have. So we had fewer taxes go into our account, but our budget didn't change. Everything that we have been asking for has been appropriated. So there wasn't a reduction there. I think it was just kind of evening out. We had so much money in the account, basically didn't need as much. And I don't know if Mr. S wants to say anymore, but basically it was just kind of a correction there. But everything, budget stayed the same. Everything that we asked for was appropriated.
She had a question.
No, she didn't.
Okay, I thought I heard her voice. Okay.
Yeah, next meeting, I'll break down some of the kind of the death certificate things. I was able to put kind of the top of the list on here, so we got that in there. But I usually put it into a spreadsheet that goes back like 6 years. So I'm kind of just finishing that up. So I was hoping to. Sorry, I had a battle with illness last week as well, so it set me back a little bit. But I'll, big cliffhanger for next meeting. So.
I noticed that the trend on median age of death is still going the
It's
wrong
not great.
direction.
Yeah, it's I was gonna say I'm trying to. I saw that too. It's a little tougher data to get into, and I need to look into that. But yeah, those deaths of despair and motor vehicle accidents, suicides, overdoses. I'm suspicious that may be what we're battling, but I'm not 100% sure on that. I got to dig into it a little more.
Okay.
It is always nice to reflect on all the work that's been done throughout the year, be able to see that sometimes.
Guys do a stellar job.
Pretty amazing. And I think we shared with them entire amnesty day. There's a page in here on that. But that was quite the impressive numbers on that a few months ago. So we'll look forward to that again. Do it again in the fall. Is that the plan?
August 9th. I think.
August 9th. All right. Late summer it is.
It'll be warm.
It will be warm.
All right, so we had the policies, the nursing policy updates that were sent out. Any additions to those that you need to consider? Just those considered? Any changes that you guys read that since?
I didn't see anything that raised any questions.
Anything that you feel like is a change from what we're doing currently? It's just more putting it and updating those policies?
Yeah, the electronic messaging and the child abuse are new ones that Eric helped me with, but those are the two new ones that we were already using electronic messaging, so now we just have things to back us up on.
So can we get a motion to approve those?
I would make a motion to approve the updates to the nursing policies.
I'll second that.
All right, we'll go around.
Brian Cobb, I approve.
Bruce Dillon, aye.
Drew Koval, aye.
David Harden, I approve.
Deborah Campbell, aye.
Oh, I guess I just, you're supposed to
I
ask.
still need to do it.
Just making fun of him.
Ryder Stratford.
All right, let's go updates. Lisa.
Yes, so again, every meeting I give you an update on the new food code. I am happy to report that it has finally made its way to the governor's office. So it'll be there, it went there March 4th, it'll be there for 15 days unless it gets extended for another 15 days. We're hopeful that it will be signed. After it's signed, there's still a 30-day waiting period before it can be enforced, but the state is going to be sending out information on more of a uniform enforcement date, even like July 1st or something, to give counties some time to implement the new code. I finally completed my standardization training with the State Department of Health, so I'm officially a standardized inspector. Still waiting on the state to determine if I can train our staff, which I think we'll be able to do, but still need some more information on that. I know you guys are always interested in enforcement. We currently have one establishment that is in enforcement. Any questions?
You know what we're gonna ask.
Maharaja. You've been told before. Yeah, so they're having some pest issues, so. And then lastly, we've been spending a lot of time watching 3 House bills that are going through this legislative season. We are most concerned about House Bill 1562. So that is the House bill that will allow home-based vendors and small farms who gross less than $1.5 million to sell any type of food product from their residence. So currently, home-based vendors can only sell shelf-stable baked goods from their residence. They can also sell these at farmers markets and other events, but this House bill will let them do any kind of food products, including, stuff that requires refrigeration. They could have restaurants out of their own home, just as long as they're grossing less than $1.5 million. So I think the intent of the bill was more for the small farm aspect, but they have also grouped the home-based vendors into that. So we've reached out to it's going to be going to the Agriculture Committee in the Senate. That date has not been determined yet, but it has passed the House. And we have sent comments to our senators regarding the bill. And then just a couple other bills. 1577 is a statewide permit for mobile food trucks. We have a little bit of questions about logistics of how permits would work and be issued. We're not overly against it, but definitely some questions that need to be answered. And then 1602, which deals with meat sales. Again, it's not too bad. So, any questions about?
Lisa?
Yes.
So 1562, if you talk to Senator Clark yet?
We've sent our comments, and Krista may be reaching out to him tomorrow because she's going to Public Health Day at the State House tomorrow. And she's gonna text him when she's there to reach out to him about that.
Okay, I'll.
He's also on the Ag Committee of where the bill is going.
That's why I asked.
Yes, absolutely.
I'll try and reach out to Senator Lysing, who's the chair.
Yes,
that
we've sent
committee.
comments to her as well.
Okay.
She was also on the original home-based vendor bill back in 2009 when it was originally passed. So we're hoping that she will note some concerns with the bill.
I can tell you that as far as uncanny allies, the State Pork Association is against this because we're worried about, meat that hasn't been inspected.
Exactly.
Crossing state lines and things like that, so.
It kind of, it's kind of scary. I just can see lots of trickle-down effect of if it gets passed.
Yeah. All it takes is one. One bad time.
Exactly.
If you've got more, that's great, but I have a question unrelated to these House bills, just to,
I did have one question.
Go ahead,
before we move
Brian.
on. So the one you said about, the bill about being able to sell out of the home, that's just selling, it's not actually someone having a restaurant.
It could be, yeah. Yeah, so like I said, it in the bill is very vague. Again, we need some more clarification on it, but it would allow, you have to, if you're gonna sell something that's time temperature controlled, something that needs refrigeration, you have to take like a food handler course. It's like a online, can't be more than a 2-hour course is what the bill specifically says. That's the only kind of food safety that somebody has to have to be able to sell. I mean, they can make sushi out of their home according to this bill, so.
Oh,
What if it's like a bed and breakfast that serves you
Well,
breakfast,
I-
does that count in
But I mean,
this?
currently bed and breakfasts have their own rule
Okay.
that we inspect them on, and we
Okay.
have one at the county, but yeah.
The author's intent was to try and have something for people that make small batches of jams and jellies and things like that out of their home. And
The original authors,
Yes.
not the current author.
yes, yes. I know the original
I have
author.
my own opinions on that.
Yeah, so it's funny how these things won't die sometimes.
Yeah, the original intent exactly was supposed to be, I'm a farmer, I have extra strawberries, I'm gonna make strawberry jam and sell them, or I'm gonna use my zucchini to make zucchini bread, like all shelf-stable products, but yeah, this is going way above and beyond.
Yep.
And then you had another,
Yes, this is, when it comes to food inspections, I just want to know what's frowned upon and what's actually not. Ate at a restaurant last week and I was able to tell that the seafood I ordered had been wiped down with ammonia to obviously get rid of the fishy smell. I've heard about this being a trick in the restaurant trade and I duly sent it back and,
yes,
you know, they took it off my bill, but I'm like,
yeah, that would not be allowed.
Okay.
If you'd like to make a complaint, we'd be happy to take that.
Okay.
There was a Hendricks County location.
yes, it was.
Whoa.
Might you notate that for the rest?
Establishment in Brownsburg, so.
Okay, yeah, we can talk after.
Okay.
I should never heard
Put on the
such a
video.
thing.
Yeah.
Make it official.
Yes.
Anything else?
No.
Kristen?
Oh, hi. Okay, so this is Zach. He's our new Live in Healthy Housing environmental health specialist. He started a few weeks ago. We're still in the onboarding process, getting him up to speed with trainings, shadowing other portions of the health department to kind of see what we do as a whole, since a lot of his position is going to be education to the public in housing. We are going to the Indiana Vector Control Association conference next week in Clifty Falls, so we're gonna learn a lot about, looks like a very tick-heavy conference, which gives me kind of itches, but it'll be fine. And then some bed bugs and
Tick
some
topic.
tick topics. Tick topics. So that'll be a fun conference to go to. Paul, Aaron, and I went to the IOPA conference 2 weeks ago for septic systems. Erin passed her certification, so now she gets to sign septic permits after she reviews them. So that's exciting for her, proud of her, that was a good job. I sat in on an Elgin refresher training. And an Elgin is a type of septic system, and we have 2 in the county right now. They're proposing on a specific lot, a 3rd one in the county. They're just very specialized systems for smaller lots that can be pressurized and go on top of old systems. We're getting a lot of these older neighborhoods that need replacement systems, and sewers just not quite here yet. So unfortunately, we're looking at these smaller, very specialized, and unfortunately pretty expensive systems. But Elgin has a cool VA program where if you're, or not a VA, a veterans program, where if you meet certain requirements and you're a veteran, they'll give you some of the items for free or at a reduced rate. So that helps with a lot of these homeowners. So that's kind of a cool thing that they do. That might be going in this summer, I don't know. Also at IOPA, the state gave an update. They are refreshing their state septic code soon. They hope to have a rough draft mid-March. They are adding some definitions, some setback requirements for cisterns, D-boxes with riser to grade, which will help with cleaning out and servicing as needed. And then they are also trying to add in the requirement for sewer connection if it's within 300 feet and less than 1.5 times the cost, less than 1.5 times the cost of a septic replacement system, which we have in our ordinance already for that, but now they're just trying to make it state. So no major changes on our end, just adding some things. House bills, we are watching House Bill 1052. They're really just working out some kinks with the technical review panel with the state, what they can and can't do, how often they can and can't meet, and what happens when there's a tie. And I don't think anything should really affect us right now, so it's the only one that's left that hasn't died yet. So that's it.
Leanne, healthy families.
Yeah, so we hired our last staff in November, and she's going through her last bit of training this week. So we've been fully staffed for a while, and that is definitely turning out more families. We've been able to do more assessments, enroll families. So in terms of programming, things are going well, and we are increasing our families every month. We got moved to our new office space, so that's probably been our biggest accomplishment, because that process was just dragging out. But we've already done our site review for this year. We had the state in at the end of February. That went very well. There is going to be some contracting stuff coming out, just a heads up for Dr. Stockbridge. There's going to be some language that's changed a little bit within our contract, but I think that process is going to be pretty slow. The state's kind of bogged down right now. So other than that, we're just trying to add families to the program and get everyone's caseload full.
All right, cool.
Alright, so we opened our STI clinic officially on February 18th. And in February, we saw about 4 patients so far. We're doing them by appointment, but also walk-ins when staff and time's available. And then our immunization nurses worked on sending letters out to different age groups that need vaccines. So to 3 to 6-year-olds, they sent 194 letters, and 10 to 15-year-olds, 324 letters. So trying to get those into the providers or to us to get those immunizations done, especially if we can catch them before school, so we're not jam-packed during that time. And then Danielle helped work on sending letters out to daycares and preschools to catch those kindergarten roundups, so she sent those out this week. And then tomorrow we start clinicals with a new College of Nursing called Hendricks College of Nursing. So we have our first students tomorrow. It looks like they're based out of Indianapolis.
What's the name again?
Hondros, Hondros. We've had a few of them come in for like their immunizations and things they needed for school, and then they sent the agreement to sign for clinicals, and I was like, oh, okay. Must be a real school.
Must be.
Oh, we'll find out.
We'll find out tomorrow.
We'll find out.
All right, and outreach.
My team successfully moved to our new space as well, which is her old space. So that was quite an undertaking. We're kind of in our planning stages. We're coming up on our busy time, so I don't have as much to report as I normally would. Preparedness is doing a safe worship at Avon Christian this weekend, and I think it's pretty full. It's an
I
all-day
believe so,
thing.
yeah.
So, and it's been a pretty successful program. They'll do one in the spring, I believe, and one in the fall. So that's coming up. We are hoping to launch referrals for our diaper pantry, I think around April 1st. I'm still waiting to hear back from some partners that I asked to kind of participate with us, but right now I'm sitting on a stock of about 2,500 diapers, all different sizes. So we're pretty excited to get that rolling. That's about all I've got this time.
So I do have a question for you, Anne. The Just Be Kind group.
Yes.
They are wanting to do kind of like a diaper drive, and
Okay.
they've done it, but they didn't know if maybe they should coordinate with you. I know Sheltering Wings has been asking for diapers.
Yeah, that would be great, actually. I
Okay.
don't know who to get in touch with. Do you have a contact with Just Be Kind?
I do, yes,
You can get that to me.
I will, yeah.
I haven't heard back from Sheltering Wings. I did, Cassie, I believe, is Sheltering Wings. She's in charge
She
of
was
it.
their director.
Right, and she never responded to me about referrals, so I'm
Okay.
planning to follow up with the ones I haven't heard
Amy
from.
O'Hearn over there does a
Okay.
lot of their,
Does she?
I think it's outreach, and she's just started coming to Avon Christian, and I know that they put out that they needed diapers and,
Yeah, and we were very fortunate. I know that the sheriff's department recently did a diaper drive, and I don't know how they distributed them, but they had some boxes left over, and they
Oh,
contacted me and had me come
okay.
pick those up, so.
okay, I'll email.
I'm hearing there's, from a lot of different people, there's definitely a need, so.
Yes. Oh, yeah,
So yeah, any information you have, I'll be glad to work with them.
okay, okay.
That's it.
Krista?
The Indiana Department of Health sent out an email yesterday afternoon that our Vital Records Department may start issuing birth and death certificates for other Indiana counties. So we started that today. So that's something that they're working on, updating their program. We still need to, if there's any amendments or changes, that needs to go back to their county that the record was filed in. So there's some coordination that we need to do, but as long as everything is correct, we can issue out-of-county birth and death certificates now. So that's new for us. We're waiting to see what impact that has.
I remember a time when we were talking about that, about what was on the birth certificates, whether it had father or not, like different, some of the details were on it, and it was different from county to county, I thought. Is that gonna make a difference?
The state's been working a lot on trying to make them more uniform, so that's
Okay.
definitely been a push recently.
Okay.
We saw that the county of origin, their health officer will print on the form, but then they'll have our seal. So it may have another health officer, and if somebody would issue a Hendricks County one in a different county, it would have Dr. Stoppard's name, but then their county seal. But the state sent out a frequently asked question list to try to coordinate this. There was a legislation that allowed for this, and it's really been a push through Health First Indiana. It's one of the KPIs. So I think everybody's, it's great service. We're just trying to figure out what impact that has. If it's a county, smaller county that people don't usually go back to, are they missing out on some birth and death certificates? Are we gonna see an influx because people don't wanna go to Marion County? We expect that, so we're just kind of waiting to see what impact it has on everyone, but, like I said, just started today. We were actually talking about how to implement it, and someone came to the window, we're like, here we go.
This is how we do it.
And it was one that didn't even change, so we were able to issue it. We went. So that's new for us. We do have 2 positions that we're working on filling. We have an administrative assistant on the immunization grant. That position's closed. We should be starting interviews for that soon. And then we have a public health nurse on the immunization grant as well, just coincidentally. That should be posted this week. The department is looking at different computer programs to kind of help us with data collection and reporting, especially for those Health First Indiana metrics that we talked about earlier, and to help us create forms, surveys, and that type of thing. So we don't want to spend tons of money on, but looking for some means of being more efficient with that data collection. And then we are going to be working with the Indiana Department of Health through April and May on a tobacco assessment project where our tobacco coordinator in our coalition will be going to different stores and looking at how marketing is done in our local stores. So that's going to be underway here in the next month or 2. That is all I have.
Yeah, just a few quick updates. Something that's kind of in the early planning stages, our schools committee, we've had it ever since the COVID days. We meet once a month with a lot of the HRH schools team, school nurses and athletic trainer leaders and Chase Cotton from the Willis Center's on this committee, and so we do a teams meeting once a month. I pick on a lot of people, including Nicole and our staff too, and Ann. But yeah, we're looking at this summer trying to get some of the school leaders to kind of brainstorm some ways to attack mental health, to look at mental health in their schools. might use a video to start the discussion. We're trying to figure out what that'll look like, but I'll try to give you guys an update in a couple months. But definitely starting to make some traction there, and some, we're trying to catch them during their slower season. Hopefully we find a nice gap in the summer at some point where they're hopefully have a little time to think about these things and make sure that they have the proper protocols in place, and see if there's any specific needs, because every school has a different infrastructure for mental health. They all have different training on what to do in mental health emergency. Just trying to look at ways to make that more uniform. But yeah, anyways, I'll to be continued. I just was thinking that over, and we meet once a month, and I heard Chase's name earlier, and it kind of reminded me that, oh yeah, I see Chase once a month now on a computer. So, we're also working on our county vaccination rates. So getting our, what do we call that vaccine team that we're putting together? What is?
Immunization strategy.
Immunization strategy. Okay. Well, there was like a group that we're.
Oh, sorry. The immunization advisory board.
And there we go. Okay.
Yeah, sorry.
So if about once a month, or how often?
They meet each quarter.
They meet each quarter.
Yeah,
Okay.
So their next one is March 18th.
Okay. So just looking at our county immunization numbers, we are in the bottom third of the state, which is about the only county health metrics that we're not in the top third, pretty much. So we're trying to figure, and that's looking at kids less than 3. So that's why we've been looking at those numbers a lot. We just got some fresh numbers from the state. We're trying to figure out what to do with and how they created them, and once again, denominators, and trying to figure out some of those details. But yeah, it's broken down into ethnicity and zip codes, and so hopefully we can come up with some plans on how to reach out to these kids. For example, is it parents just not believing in vaccine, or is it parents can't get into a pediatrician because they don't have enough providers, or are there people that start the vaccination series and then quit seeing healthcare providers? There's a lot of different nuances that we're trying to figure out what the problem is first, and then go attack it from there. Obviously, Nicole was talking about a bunch of letters that went out for a lot of our kids that we know are not up to date. Kind of the low hanging fruits, the people that we see. But yeah, looking at those vaccination rates and trying to ramp those up. So I know I've been meeting with Nicole and her team at least monthly, every other week, something like that, brainstorming some ideas, and then our quarterly meeting for the advisory board. Yeah, okay, all right, I got it right that time. Is coming up too, so I'll try to log on to that, hopefully. But yeah, so that's a big deal. And then finally, all these great projects and cool presentations. Everybody here is going to hear me a whole lot talk about advertising. We need to become a very good advertising group. So because we do incredible work, but I'm not sure if many people know about it. So, but yeah, and I know the resource guide gets kind of a pass because it's been in production for a while. So I get that, but yeah, now that it's done, I mean, if we have funds to be able to advertise, if we want to look at it that way, or it goes from the we're talking about our community award grants that Larry helped us out with. So I'm very appreciative for him being on the committee to once again we were just presented earlier today to our STI clinic kind of getting up and running. I mean, it's advertising. So we need to figure out a way to get these great resources and great ideas out to the community and out to providers. And so we will be brainstorming on some ways to become a good advertising agency here soon.
No, I think it's vital. I think just look at all the work you've done, Michael, on that with that site. You got to make sure it works. If you're going to advertise that it works, it needs to work. Like, so people want to reach out or get a hold, then it has to make those mechanisms are there to get follow up or to get reach back out to, or those kind of things. So I think so many resources people have no idea that are available to them, that their taxpayer they're paying for it, they just don't know it's there, so. use it. One thing on the health first, I've always thought with vaccinations, just being in our office doing vaccines there, like it seems like Danville is a very difficult place for under-resourced people that live in Avon, Brown, Plainfield, to come to Danville. They're not likely to come here to get their shots. Some do, but like if you're getting seen in an office on the west side.
We're trying to address that, yeah.
So if we do like vaccine sites in those communities, so you don't kind of go there and get your shot. Some days it's a rotation, there's a small site. I don't know. You guys have thought about it though, it sounds like.
Yeah, so that's one thing that we've been talking about for a while, and so I've actually we're at the beginning stages of communicating with Uber and Lyft to kind of come up with a transportation system in which people can essentially book a ride to the health department to get vaccines and get back home for free. And so the goal is to hopefully have it sometime by the midpoint of the year, but that's something that we're trying to work on.
Great. That's cheaper than owning space in Avon and Brownsburg. Okay, you pay for some Ubers, especially if they're willing to work.
Yeah, and we have great relationships with a lot of our local providers and hospitals and things. Once we are confident on how to maybe take some vaccines on the road, we may go use office space, or bar office space from, when providers aren't in the office on their Thursday afternoon off, maybe we sneak in there. I don't know. There's all types of brainstorming ideas, but obviously we got to work out some of those details because there are a lot of when the vaccines leave those refrigerators downstairs, there's a lot of rules and and a lot of stress for Nicole. And so we have
All your
to.
places, we can just pop in and put it in those refrigerators.
Yeah. So we will, like I said, a lot of details. It sounds easier than it probably is, but yeah, we're definitely thinking along those lines too. So.
Great. Public Health Day, March 12th at the State House. Larry, you got anything for us?
Well, as you may know, the council, like the commissioners, on our first meeting of the year, our president, vice president, and designates representatives to the different bodies, Fair Board and Health Board and so forth. So we had moved our meeting to the third Tuesday of each month rather than the second. So when I was here last time, I was not designated at that point, but by virtue of me being here now, you can conclude that I have been designated as the liaison to the health board for this year. But I don't have anything important, I guess. But while I have you here, discussing the measles situation, vaccination, I'm one of the lucky ones. I got my immunity the hard way before there were vaccines. Matter of fact, I was so lucky I had measles, chickenpox, and mumps simultaneously.
Oh my.
But I was wondering, is there any study to indicate whether the immunity that's derived from experiencing the disease is any better than that from vaccine? Yeah, I'm wondering if I need to get a booster. I guess that's what causes me to ask the question.
Yeah.
I don't think it's going to be any better necessarily. I think it's all going to depend on the prevalence in the community.
Okay.
So that if it cannot pick up steam, people are going to be okay. But if enough people get it and it starts picking up steam, then you're going to maybe start seeing those that thought they were vaccinated and it didn't take, or they had a mild case and their natural immunity is waned. That happens for people, especially if you're on immune suppressing medicines or treatments or those kind of scenarios. So if it can pick up steam, enough people get it, then there may become an issue, but at this point, it's not doing that. And the hope is then that's when, if communities in that herd immunity that can be there, just keeps it at bay, there's gonna be outbreak, but it doesn't really go away, as you see, that those infections are there. It's just, we just don't get enough people vaccinated, it can't catch momentum like an influenza or things like that can.
Yeah, I would say natural immunity for measles is
Pretty good.
pretty darn good. Yeah,
It's
yeah.
been like that way for
Yeah.
centuries. I mean, that's, if you make it through your measles as a kid, you don't get it again. And especially when before vaccine, you didn't get it again as an adult then. But again, you were constantly getting exposed to it, so kind of was a natural booster in the environment around you. And now is not the case.
Thank you.
So clear as mud, right?
Yeah, clear as mud, there you go.
I'm somewhat comfortable.
I don't have any updates. I mean, they've covered what we went through this month, or past 2 months.
Me?
Your floor, sir.
Okay. Well, this probably comes under wishes to be heard, so Eric timed me, I'm limited to 3 minutes.
That's right.
As you know, I normally, during a year, I have to attend at least 2 of these meetings virtually. And as Crystal will attest, it's hard to get engaged when you're virtual, isn't it?
Yes.
Well, I can see where starting after this year's football season, my youngest grandson's going to be a senior for football season this year. And after that season, I can see me spending more and more time in Florida, which is going to have me here for less and less times in person. And I don't really feel like attending virtually that I can really give the staff and the rest of the board the support and the input that they need. So after the September board meeting this year, I'm going to be resigning my position. I just want to tell everybody how much I've enjoyed serving on this board. I don't even know how long it's been, 10 years, 12 years, something like that. I'm not sure what it is.
I think at least 12 years now, because
Yeah.
I came on at the same
Okay.
I've been here 10,
time.
so it's
But
been
anyway,
COVID.
I've enjoyed it so much. When I came on the board, I knew absolutely nothing about public health, and now I know at least a little. But anyway, I appreciate everybody's, the friendliness and support, and I've loved working with you. And I will be, at all the meetings between now and September. But anyway, thank you all.
Thank you.
How are you doing?
Eric will talk about, like, how we go about with the new rules and all that kind of stuff, what we need to do. Yeah, replacing Bruce, so. Any other?
No, just thank you, Bruce.
Yeah.
Yeah, just an amazing. I've been here for 10 years, and you've been here the whole time, and your knowledge as an engineer and just your general knowledge as a person that cares about the community and wants to do the right thing. Can't thank you enough for all your service to this board.
I appreciate it.
And I can see the lure of wanting to spend more time in Florida.
Well, I have 2 young granddaughters down there who are getting more and more involved in activities.
Even more.
As the youngest here is out of activities, they're getting involved down there, so need to be down there to watch them.
Wonderful. Sounds fantastic.
We have to get somebody else to be the heavy then. When somebody
Kids aging out of activities.
Any other comments, concerns? Any motion to adjourn?
So make a motion to adjourn the meeting.
So moved. We're not gonna take a vote on that.
All right.
Thank you.
Thank you.
Thank you, Crystal.
Thanks, everyone.
We get you to September.
Yeah.
How you doing?
Through September.